Women and even men diagnosed with breast cancer have more weapons to go to war against the disease, along with improved procedures for keeping their bodies looking the same. Sabrina Wilson reports.
Breast cancer still strikes too many.
I can't overestimate enough the importance of screening mammography.
Dr. John Kofri is a breast surgical oncologist at Turo Infirmary.
Sometimes a mammogram is not enough, especially in young females. They tend to have very dense breast tissue.
Genetic testing, he says, has become an invaluable tool.
The biggest advancement that's been made in breast cancer over the last 20 years, by far, we have a much improved understanding of tumor biology, and then as a result we're able to prescribe appropriate treatment depending on the exact cells.
According to the American Cancer Society, breast cancer remains the second leading cause of cancer deaths in women, and here in Louisiana the rates are disturbing.
Louisiana is in the top 5 highest death rates per state for breast cancer. And honestly, I think some of it has to do with just awareness of screening mammography. And I think, unfortunately, some of it has to do with access to care.
A breast cancer diagnosis is not an automatic death sentence, and patients have many more options.
Breast reconstruction has evolved quite a bit, and the evolution has been pretty rapid. So the breast reconstruction that was available 15, 20 years ago.
Dr. Craig Bloom of the Center for Restorative Breast Surgery in New Orleans believes immediate reconstruction is an option in most cases.
Meaning you go to sleep with breast and you wake up with breast. And so after the mastectomy is done, we will fill that space with something. And so the options are either using an implant, or we specialize in using your own body tissue. So we can take skin and fat from other areas of the body without the need to damage the muscle.
The body tissue route may not be for all patients, but if you're a good candidate for that procedure,
it's generally taken in an area where it's undesirable anyway. So you're taking the tissue that would be used for a tummy tuck or some of the upper buttock tissue.
And he dispels the myth that using one's own body tissue could end up putting cancer cells back into the breast area.
The fatty tissue that you take either from the abdomen or from the hip area remains fatty tissue from the hip area. It's just been transplanted in that spot. And so there's no risk of developing breast cancer in that tissue any more than you would develop breast cancer in your belly, or breast cancer on your hip. It just can't happen that way.
Bottom line, early detection is key, and the arsenal for fighting and living with breast cancer is ever expanding. I'm Sabrina Wilson, Fox 8 News.
Dr. Colfrey of Turo urges women to do breast exams and get mammograms when their physician suggests they do. The community will come together later this month to raise awareness about breast cancer and money to help the battle. The Susan G. Komen Race for the Cure is Saturday, October 24th at City Park. Fox 8 is proud to be a community partner, so head to our website, fox8live.com, to sign up or donate.